Live, I'm Josh Fenton, CEO and co-founder. A little breaking news, GoLocal just broke exclusively that Amazon is looking to build a 1 million square foot warehouse in Johnston near the Route 6 295 intersection. It would be one of the biggest facilities ever built in Rhode Island, and it would take up about 100 acres. This facility would be the second major one in southern New England. There's a facility built a few years ago over by Fall River. Presently, right now, Amazon has over 100 job opportunities for Rhode Islanders. This might increase it to more than 1,000, could be as many as 1,500 new jobs. This is part of a strategy of building warehouses throughout the country. They're looking to build facilities of about somewhere around 1,000 across the United States. We'll give you more updates as we get them, and take a look at that article now on GoLocal. Let's go to Dr. Michael Fine. He's the former director of health. We've got new numbers from a long weekend. No data over the past few days from the Rhode Island Department of Health. Dr. Fine, what do you think with these new numbers?
Overall, good news. Still way too much disease, but the trends are very promising. I think our number of new cases per day looks like it's down around 1,000. When you put it all together, hospitalizations appear to have dropped, but I always want to wait a day or two after a weekend because it sometimes takes a couple of days for the hospital numbers to catch up. But if these numbers continue in the direction we're going, we are in better shape than we were a month ago, and much better shape than I expected us to be. That doesn't mean that we're in good shape. We still have to anticipate losing 300 to 400 Rhode Islanders, probably closer to 300 in January, way more than we'd ever dreamed of. But still, the number appears to be going down, not going up. That said, we have to keep our eye on the ball. Make sure that everybody's masking and social distancing, because floating around out there is what's called the Great British Variant, the variant of the virus that spreads more rapidly. If and when that hits us, I expect our numbers to go up, our new cases and our hospitalizations to go up, and we can't tell yet by how much.
Massachusetts recorded its first positive test for the British variant, that strain. That is argued to be 70% more contagious. A number of other states around the country have registered cases. Rhode Island has not, but we're not sure how much testing that is being done. It's a different test than someone, whether or not they are testing positive or not. So we'll have to wait and see on what the Rhode Island Department of Health is doing to identify it.
Yeah, my understanding is that the Rhode Island Department of Health is testing about 100 people a day, which is good, but only testing people whose tests are sent for PCR. All those people who are getting Binex testing only are likely not getting tested for this variant, and that's a potential hole in our strategy.
Dr. Fine, a lot of things happened over the long weekend. First, let's go to Friday night. President-elect, soon to be president, about 23 hours from now, President-elect Biden said he was going to promise the American people that he would have 100 million folks vaccinated in the next 100 days. There were a lot of holes as to what he meant by that, and there's obviously questions about how much supply there is, whether or not he's counting the 12 million that have already been vaccinated. But there's a lot of work to be done to get 100 million Americans vaccinated in the existing structures that we have right now.
Yeah, though I think we can do it if we have supply. If we have supply, if we have leadership, and if we have somebody really putting their foot on the gas. This is something our communities know how to do. We just need to give them the resources and the direction to get this done.
So the CDC says Rhode Island's received 108,000 doses. And according to the Rhode Island Department of Health's data today, the Rhode Island Department of Health has vaccinated around 55,000, 56,000 Rhode Islanders, up about 13,000 since a week ago. So from the 12th to the 19th, have vaccinated about 12,000 people, which is, 2,000, short of 2,000 people a day. At Rhode Island's pace, the vaccines here, according to the CDC, maybe some portion of it is out their door and hasn't reached here quite yet, but Rhode Island's received a lot more than 55,000. Last count we got from the Rhode Island Department of Health, they'd received 72,000, but that's 10, 11 days ago that we got that data from them. I will say this, the CDC updates their data on a regular basis. It's completely clear. The Rhode Island Department of Health reporting is far less clear. Regardless, Rhode Island's not been able to get the vaccine out the door and get people vaccinated.
Well, I'm hoping that will change. I keep hoping that will change. I don't know what the holdup is exactly, except I know we're not yet using the municipal opportunities. The good news is that primary care physicians, I think the department changed its policies. Some primary care physicians were getting immunized this week, and I'm hoping we can start using our primary care colleagues to vaccinate people, remembering that it looks like the pharmacies are ready to go and anxious to start vaccinating people. I think everybody just needs coordination and the green light.
40 days into it, a lot of still needs. Let's go to another number, Dr. Fine. GoLocal broke a story over the weekend. According to the nursing, first we talked to some nursing home operators. They said they're having a terrible time getting workers within the nursing home industry to take the vaccine. One said it was 50%. The Nursing Home Association said the percentage of workers in Rhode Island nursing homes who took the first dose, and they were a priority, was only 60%. So 40% of the workforce is going home each afternoon or each morning whenever they're getting off their shift. They're going back to Providence or Central Falls or Pawtucket or Barrington, and they're going back into a home environment, and they are running the risk of exposure and getting the virus, and then are going right back into the nursing homes.
Yeah, I mean, I have a history of being kind of a vaccination militant about this stuff. It doesn't seem to me that people who work in nursing homes or are doing active patient care should be allowed to work unless they're vaccinated. Now, that's going to freak a bunch of people out, and I'm sorry about that. But I think this is a core and critical public health issue that needs to be addressed frontally, and that we need to stop being afraid of public health and its enforcement. If we're going to stop this, we have to, follow some rules, because the virus doesn't really care about whether we feel like getting vaccinated or not. I understand their safety concerns, and I respect those. But I think if you're one of those people who feel like you aren't comfortable being vaccinated, then I think you need to step back from patient care right at this moment.
Dr. Fine, it's shocking, I think, for all of us that it would ever be allowed, now that the vaccine's out, that you'd be allowed to go and interact with the absolute most vulnerable patients, those who are in nursing homes. They have multiple health issues. They're elderly. We've already lost 1,200 of them in the state of Rhode Island. 25 nursing homes have had more than 20 deaths. Why would we ever allow this to go on?
Josh, our response to this pandemic, in my view, has been characterized by the failure of enforcement. We seem to be afraid to tell people what the rules are and expect them to follow the rules. I don't get it. We didn't enforce isolation. We didn't enforce quarantine. We've done some enforcement about bars and restaurants, but that's about it. And this is part and parcel of this same, you don't have to follow the rules. Everybody gets to do what they want. there's no way to stop a pandemic if everybody's doing what they want.
Well, speaking of doing what they want, it came out on Friday, I believe, that non-medical employees and non-medical board members and trustees of the two leading hospital groups in the state of Rhode Island, Lifespan and Care New England, who are not anywhere near a priority list. They're not in phase 1 priority. Their names aren't there. Their profession's not there. There's no way, no how they should have been vaccinated according to phase 1. Understanding that 75-year-olds and older are not in phase 1, got vaccinated. The hospitals finally came clean on it. There's no rules. This is the wild, wild west. I know a guy, I'm wealthy. Not only did they get it, but the hospitals gave it to them. On both ends, this seems irregular, illegal, and immoral.
Yeah, and you know, I'm scandalized. I'm freaked out by that. I'm very disappointed in the cynicism that represents. But I really think the Attorney General should use the power vested in him in the oversight of nonprofits to move against their nonprofit status. I don't think we should play games like this. This is a pandemic and a time of great sort of social instability. We need to respect these kinds of basic rules and respect the needs of others as we try to stop death from this disease, and to have hospital board members who are, you know, who have a significant public trust engaging in this kind of behavior. You know, I don't think it should be tolerated by anybody. Both the Attorney General and the Department of Health, which has considerable oversight over licensure, should move clearly, move decisively, and begin to talk about either taking licenses away or taking away nonprofit status.
Dr. Fine, Rhode Island's Attorney General Peter Nerona's wife works at Coastal Medical. Coastal Medical's in the process of negotiating a merger with Lifespan. Do we think Peter Nerona either could do that or has the willingness to turn over those investigative powers to someone else to make sure that those take place? I have to say, I agree with you. Nothing more during this entire process has bothered me more at every level. And you know, both of us know members of those boards. We don't know who exactly got them, but we certainly know that non-medical trustees and board members of those institutions receive vaccines completely out of place. Remember this, people with multiple underlying health issues and who are over 75 years old, who are completely exposed, have not been able to get vaccinated here in Rhode Island yet. These are people who are highly vulnerable and in many cases haven't left their homes in months, have not seen their family members for months, but bankers and lawyers and captains of industries jumped the line and pushed them. I call it pushing them out of the lifeboat. Is there anything worse in this process? Most of our failures have been incompetence. This is competency. I'm getting mine first.
It's moral corruption. It's what it is. And I don't think it's just hospitals. My guess is it's hospitals and their administrative staff. It's not just board members. It's people who don't do patient care.
Yep.
I think there are other healthcare organizations. You know, I'm betting that there are a bunch that we will find out about where this has been done, and it is, you know, totally off the. You know, I mean, we unfortunately don't have a law against it yet. In New York, I think they've made it illegal with huge fines. We ought to do that and do that quickly, so that people stop trying to game the system. Because not only is it unfair to the people who are over 75 and who are at risk, it makes people more cynical yet about our political system at a time when we need everybody to sort of come to the table and be together to defend this democracy. And this is a sort of cynical attempt to undermine the fairness of the democracy, which is critical for everybody if we're going to be able to preserve it in the face of this most recent onslaught.
Dr. Fine, you get the last word. It's Tuesday, it's January 19th. Tomorrow we get a new president. We'll soon have a new governor. Are we going to see major improvements into how we manage and respond and vaccinate Americans and Rhode Islanders?
Josh, this is the time for us to roll up our sleeves and take this on as one people. This is the time for us to actually join together, really go shoulder to shoulder, though 6 feet apart, and put all our energy into stopping this virus, which we can do, but we have to do it together. This is the time for us to sort of take the moment that the inauguration presents us with, and turn our back on a divisive past, and move toward a focused and effective future.
Dr. Michael Fine, as always, thank you so much for joining us today. For everybody else, stay tuned for more news. It does not stop. As again, I'll repeat, GoLocal broke a story just about an hour ago, maybe an hour and a half ago, that Amazon is looking to build a major facility, 1 million square feet on a 100-acre parcel of land in Johnston, Rhode Island, near the 6 and 295 intersection. That would be a major, major development here in Rhode Island. And take a look at that. We'll be reporting more on it over the next few days. Everyone, please, please stay safe, wear your mask, and take care of each other. And look forward to talking to you more later today or tomorrow. Thanks.
Thanks, Josh.